Hi everyone, Treat from ALTERDOCTORS is an online magazine for doctors. We are here to present to you a new feature which talks about some of the defining points in healthcare, some current affair news and much more. Right now, the big burning question is regarding the most confusing period in a medico's life in India. And trust me, there is no neat answer for this. Yes, I am talking about the post-NEET results counseling time. Now, this is a time when we know that there's a lot of confusion, a lot of apprehension, peer pressure, parental pressure. Am I going to make it? Am I making the right decision which is going to impact my future? And there are a lot of questions swirling around in the head, and some of these questions might be important and some might not be. Now, at the outset, I would like to emphasize that this video is not here to give you all the answers, but to guide you in asking the right questions before you make that important decision of choosing the PG seat. So the first question that comes across is, do I actually choose a seat this time? Now this question is mostly faced by quite a few of us who get the mid-range ranks or the low ranks, and we don't get the subject or the college of our choice. And then the doubt comes in, should I just take off any subject, or for that matter, should I just take some subject in some college because I'm getting a seat? Well, the answer to that question is something that only you and you alone can answer, because you're the best judge of the effort that you have put in for this exam, and you're the best judge for the performance in your exam. Don't be pressurized into taking up a seat just because all your batchmates are. There are a few who have wanted general medicine all along. They've got an anesthesia seat, but they have refused it and cracked the exams better after 2 to 3 years, and today are happy doing what they always wanted to do. On the other hand, there are a group of people who took any subject that they got at their first time, but today are regretting it with lot of doubts and queries. So especially if it's your first attempt and you know that you have not given your best, or that you messed up your performance, you blanked out, or you made a lot of silly mistakes, give it another shot next year. Remember, giving up 1 year or 2 years now is really not going to make a difference in the long run of 20 to 25 years of your career. But remember that this essentially is a choice that would determine what you would be doing for the rest of your life. However, on the other hand, if this is your third or fourth attempt and you ended up getting a decent rank, and you're sure that this is the best that you've given over the years, then it would be wiser to consider the options in front of you and choose a seat. But yes, it ultimately all comes down to you, whether you think that this is the best you've put. Is there more left that you can deliver a better performance next year? And more importantly, can you be motivated enough to slog it out for one more year? So the same principle would probably be applied to the next question. Do I choose a subject or do I choose the college? Now, according to me, the answer is varied and depends on two scenarios. Now, if you're passionate about one subject, or you've already dreamed of becoming a cardiologist or a neurosurgeon or an obstetrician, you should stick to pursuing it, because again, the same principle applies, that this is something you would be doing for the rest of your life. So do something that you are passionate about, something that you enjoy doing, something that would not make you just go to work and come back like a monotonous 9 to 5 job. Think long term and not short term. So when it comes to this matter of choosing subject over college, I always think that it is better to choose the subject you want, even if it is in an average college, rather than taking up subject you don't want or didn't have any idea about, and you took it only because you were getting it in a college of repute. But let's move on to our next question. Let's assume that you're okay with any of the 2 to 3 subjects and you know in which order of preference you want them. How do you choose the college? So the most important aspect to find out about is A, the exposure to the number of cases, or in other words, the volume of cases, and B, the opportunities given along the course to take independent supervised decisions. Nothing, and I repeat, nothing can beat the exposure you have during your residency to a huge volume of cases, because like William Osler said, he who studies medicine without books sails an uncharted sea, but he who studies medicine without patience does not go to the sea at all. So remember that. Try to look for colleges which have a good number of patient load, both outpatient and inpatients, because the clinical competence that you come out with depends hugely on this factor. Also remember, give equal importance to the opportunities. Like let's say if you're in a surgical field, the surgical chances you get in OT, and if you're a physician, the ability to take independent decision under supervision on night duties and emergencies, or the ability to start seeing patients on an OPD basis independently under supervision. Try to speak to the current postgraduates and inquire about these factors before making a decision. One often discussed part is how much importance should be given to the academic program of the college. And I would say that rather than focus on the structured academic program, try to find out if there's an academic atmosphere in the department. Do the consultants teach during rounds? Are you able to develop a rational thinking for the investigations you ask or the diagnosis you make? The freedom with which you're able to ask doubts at any point of the day, the quality of case presentation, and in today's world, is there good support and emphasis for research training and publication of papers? Now, remember at the level of post graduation, and especially in today's world of up to date websites and a lot of journals, a structured academic program slightly becomes redundant. So don't go giving too much emphasis when you're trying to choose a college for a structured academic program, but yes, try to find out about the other points that we just discussed. Now, having said about the above qualities, now these need to be balanced out with other important factors. One definitely is the working environment. Try to find out that if it is a place with good system for the postgraduates, which is very important to avoid burnout, and that the faculty in the department are sensitive to the needs of the postgraduate. And the other important things are, does the college have facilities of standard of care? Now, this is a difficult one because quite a few government colleges lack investigations 24/7. So, if you were to choose purely based on this one point between a government college which sees a huge number of cases versus a teaching college which have investigations which are the standard of care available round the clock and with a decent number of cases, I would choose the teaching college, which is a non-government medical college, rather than choose the government medical college purely because of cases. Because during our training, it's very important that we know what the standard of care is, and even more important that we are able to implement it round the clock. Also, of course, before counseling, try to log on to the relevant websites to find out about the fee structures and also the bond in the states for the government seat. Nothing is better than trying to talk to people who are studying currently in the college. Now, apart from them, also talk to people who have passed out from the college and people who have sometimes left the seat in the college so that you get different perspectives before you make that final decision. So that said, let us move on to the crucial question on what factor goes into choosing a subject. Now, the way I see is that few of us are inclined towards medical fields, few towards a surgical field, and few of us who are more comfortable in the pre and paraclinical subjects. But essentially, when we speak about clinical subjects, are we looking at broad specialties or are we looking at end specialties? Now, a few of us during MBBS and internship period have probably made up our mind that we want to be a neurologist and an oncologist, a cardiothoracic surgeon, a plastic surgeon. But it is important to understand the journey that is required to get to there, the long years which is required to establish, and that one should be mentally prepared to slog it out for yet another set of exams. Now, also when you're choosing a broad specialty, try to think what would happen if you don't choose to further specialize or if you're not able to further specialize. Is there still scope for you in the city that you intend to practice in for the broad specialty? Are there ample teaching opportunities? Is there scope for you to branch out into research or other fellowships? And more importantly, will you have professional satisfaction with the broad specialty? Now, when you're choosing an end specialty, be cautious and fully confident because unfortunately our educational system does not give us much exposure to a few of these end specialties barring a few weeks during internship. Now you may know that subjects like medicine, surgery, OBG, pediatrics, one gets enough exposure since second year MBBS with long postings in internship. But subjects like ophthalm, ENT, psychiatry, dermat are limited to a few weeks. So don't choose an end specialty just because of the hype around it or because the toppers are taking it or the so-called chill working hours. But speak to people working in the department, and I would advise to speak to a different strata, right from the postgraduates to the recently passed out senior residents and the assistant professors and the more experienced professors to get a balanced perspectives regarding the scope, the pros and cons, the saturation in the city that you intend to settle in, and etc. Also remember that when you're choosing certain end specialties such as anesthesia or radiation oncology, these are not possible for independent practice and are dependent on institutes. So also try to find out, especially if the city you are intending to settle in are tier 2, tier 3 cities, inquire about the scope and saturation. Now, there's always a trend that sometimes you want to take radiology because the toppers are taking, but once you take up, you realize that you're more of a clinician who enjoys speaking to patients and you're feeling disgruntled and disappointed sitting in a cabin. So always when you're taking an end specialty, try to spend a few days in the department to know what it is all about and whether you really like it before you make that decision. So when it comes to pre and paraclinical subjects, now this is one exception where the institute really matters because it's the top institutes who have a reputation in these subjects over the years which are different. They're different because they provide ample academic opportunities. They provide ample research opportunities. They have got a lot of publications, and this really sets you apart when you are trained in pre and paraclinical subjects from these institutes when you come out. Also, when you're planning to pursue pre and paraclinical subjects, try to inquire about the laboratory infrastructure. Do they have state-of-the-art facilities? Are there new innovations or new research projects which are going on which could potentially be path-breaking? Because when you emerge out in a pre and paraclinical subject, your foundation in academic and research really needs to be strong, and it's only these top institutes which can impart that to you, which can set you apart. So in the end, just make a list of the subject preference in the order based on the factors that we have discussed so far, and following that, then make a list of colleges for each of the subject preference. What I really hope is that the concept of shadowing soon starts in India. Shadowing is a concept where students or medicos spend some time in the department before they actually take up the subject. We can get a lot of information by talking to different people, but nothing can beat by actually spending some time, maybe 2 weeks or 3 weeks in the department before taking it up as a subject that we want to pursue as a career. Who knows, maybe we are passionate about something, but after working in the department and knowing what it entails, we may decide to back out, or it may be vice versa, that we may not know anything about a subject, but after spending 2 to 3 weeks, we may be fascinated by it and may want to pursue it as a career. And with that, we come to an end of this presentation. I hope that with this presentation, we have been able to clarify some more on the questions and points you need to consider and ask before you choose a postgraduate seat of your choice. And well, if this presentation has ended up confusing you more, well, here's a simplified algorithm that is being forwarded as a WhatsApp joke these days. But on a more serious note, please do not be apprehensive and anxious about getting a postgraduate seat. It's not the be-all and end-all. There are many more avenues which are available in this huge and vast field of healthcare and medicine. And well, that by itself is a talk which we hope to have on some other day. Well, this is Dr. Nitin Yashas signing out and wishing you all the very best for your NEET PG counseling. And here's hoping that you get the seat and the college of your choice. This was a presentation by Treat by ALTERDOCTORS. We are the online magazine for doctors with the motto of enlighten, empower and entertain. And with this presentation, we hope that we have succeeded in trying to achieve all these three qualities. You can visit our website at treat.alterdoctor.in. You can also follow us on Facebook at facebook.com/treat4doctors, and you can also mail in to us at treat4doctors@gmail.com. Do write to us if you have any queries, feedback, or any other topics that you would like us to cover or address. You would see many more videos in the days to come. Till then, goodbye. All the best again.